Hi everyone! So for this week's discussion, I chose to look at the American Counseling Association's Code of Ethics. One component of the counseling process is the use of assessments. Assessments take into account the personal and cultural context of a client. Evaluation, assessment, and interpretation are such an integral part of the counseling process that the American Counseling Association's Code of Ethics has an entire section outlining the ethical responsibilities of counselors using assessments. The primary purpose of an assessment is to gather data regarding the client. As a counselor, you have an ethical responsibility to appropriately use the assessment, score it, and interpret the results. With this information, counselors must keep in mind confidentiality and limit the sharing of the results to only the clients or whom the client has designated if this is applicable. Counselors have an ethical responsibility to recognize cultural differences and be culturally sensitive in regards to their clients' results. They also need to keep in mind both the historical and social prejudices of misdiagnosis. In order to help eliminate some of the risks of a misdiagnosis, counselors need to make sure they are choosing the most appropriate assessment. The American Counseling Association's Code of Ethics does an incredible job at outlining the ethical responsibilities of a counselor when it comes to assessments. However, there were a few areas that I wish they had expanded upon or felt like they could have added further clarification to. The ACA Code of Ethics addresses the client referral information, stating that if a client is referred to a third party for assessment, the counselor must provide sufficient objective data. I felt that this could have been expanded upon because it left me wondering what the standard of sufficient was and who gets to decide what that is. Is it the third party or the referring counselor? Or was it the client? I was also left surprised by section E13C that addresses when it is prohibited to evaluate a client. It stated that you could not evaluate a former or current client. It goes further to state that counselors do not counsel individual clients that they are evaluating or that they have evaluated in the past. My question was, what ethical issue is there with counseling a client after an evaluation? Thank you everyone for watching. Have a good rest of your night.